start recording here. Okay, so a lot of you guys have been asking me about scar tissue. So we have a patient here. I'm not gonna review his name, and he had a fairly long scar. I'll say relatively long. It's approximately 3 to 4 inches long, and the width is approximately half the inch to a little bit over half and a quarter inch. So he had this surgery, somewhat reconstruction surgery back in 6 years ago, and the surgery helped him to restabilize his left shoulder and then regain similar mobility as his right. However, 6 years later, he has slowly developed some mild symptoms down to his left arm. So he came in presented with symptoms like mild weakness and sporadic tingling, numbness sensation down to his left arm, carrying grocery bags and doing boxing. He does Muay Thai. So he's very active and very healthy, and he's in his early 30s. So this is a good clinical case to take a look at what scar tissue would, how I treat it in clinic. Now the first thing is we look at the scar. Now as you can see, the scar looks within normal range. There's no darkness and no abnormality can be seen. If you go to this side of the angle, you can also compare the dorsal side and the head side of the scar tissue. They look similar, uniform. All right, so the next step is to do palpation. Now palpation is really the key in terms of to assess the health of a scar tissue. Well, the first thing we are looking for is we do palpation along the scar and see and find whether there's any nodule developed or any fluid that can be palpated. You won't know if it's fluid until you feel this a sense of waviness. And now you can also see whether there's any edema accumulated around the scar tissue. Now you can use this method just to poke around it and see the tissue effusion rate. Right here you can see a mild edema here, but here it's okay. Now, and then second one, I like to use a rolling method, which is to roll vertically along the scar, so you can see, well, in this case we'll be feeling textilely. You can feel the shape of the scar, and then we roll horizontally as well and assess if there's any thickening or if there's anything that disrupt the pattern of the scar. So in this particular case, the patient so from what I've noticed during the palpation is that the dorsal side of the scar tissue have a mild thickening of soft tissue, just like halfway above, from here and up. Do you feel any pain around here?
No, not too much.
Okay. Now, sometimes we can ask whether they feel pain. If they feel pain, normally there's a mild adhesion that's been developed, and the opposite side of the scar tissue feels normal to me. All right. So now we've done the assessment, and now we wanted to work on the scar. And for me, the common tool I would like to do would be Graston as a foundational therapy, well, which helps to obviously increase blood flow to the region. So just like that, just to go along with the scar. and make sure that the scraping instrument is fully contacted on the top of the scar, and also paying attention to details, like particularly granularity, to see if there's any granular changes along the scar. So on the top upper quarter of the scar here, I can feel there's some sandpaper-like texture of the scar. And below here, it's within normal range. I didn't expect anything that can be felt abnormally, but here can feel some sandpaper-like texture. So I'm gonna go a little bit harder, go up to the epidermis layer, can just apply more pressure and create more traction to it. That feels okay?
Yeah.
Okay. That looks like a pretty good warm up there. All right.
At least
Oh, yeah.
5 to 7 days to get up and keep moving. And
To me would be, first day I felt over 200 times because it was just countless, maybe over 100 times just on the bunny hills.
Really?
But,
Okay.
yeah, and also I just have a longer legs, so I have shorter arms. So when I get up, it's just no matter what way, it's gonna be hard to get up.
Okay.
Yeah, so I spend a lot of time just trying to get up. So now next step. Now since this is a scar, now I'm going to use the hypodermal needle to kind of break down some of the underneath adhesions. Okay, gonna find the portion of the scar that's more adhesive. Okay, under my digit, I can feel more under here. Okay, quick pinch. Now once I get in here, and I will just go to, and I'll go to this. It's called a. As I wiggle the needles left and right, just to try to disassociate some tissues underneath. And now go to different angle. Now retrieve and continue, and withdraw again. Go forward. Now go to a different direction. There's a trigger point here, I can see. There. You can see a twitch. That's a trigger point response. There we go, another one. Nice. Done. Okay?
Yeah. Try skiing again if you weren't standing up much snowboarding.
I think I can do it, you know? I think it's more like, I do believe the neuroplasticity. Once you learn it, you have the memory, and then you always remember how to do it again.
It's hard to get better though at snowboarding. It's easier with skiing.
Yeah, that's why. Because I think just the structure, what it looks like, because you're standing and then you're using your hand to assist you, and then snowboarding is more difficult to begin with. Oh, jeez. Yeah, now it looks pretty red.